I'm Lauren Cochran, the Director of Clinical Faculty Development here at CUNY School of Medicine. And in this video, I'm going to walk you through a few of the key policies that all of our clinical supervisors should know about. First, I want to talk about duty hours, and these policies are pretty similar to residents. Our students should work no more than 80 hours per week, and this can be averaged over the length of the rotation. The maximum shift duration is 24 hours with up to 3 additional hours allowed for sign-out. In the emergency department, our students should be on duty for no more than 12 hours straight. And finally, our students should have at least one 24-hour period off every 7 days. Next, we'll talk about absences. And unless you are the clerkship site director, students should not be asking you if they can have this day or that day off. For any absences, students are supposed to notify 3 people. Number 1, our student affairs department using the email address absence@med.cuny.edu. Number 2, their clerkship coordinator. And number 3, their clerkship site director. In general, our students are asked to make up any time missed, even for approved absences. The clerkship site directors organize that. And the only other thing I wanted to mention here is that if a student is supposed to be working with you and doesn't show up, kindly let your clerkship site director or your clerkship coordinator know. Moving on to supervision. We know that medical students cannot provide patient care in an unsupervised fashion, but we have 2 levels of supervision available. The first is direct supervision, where you are there with the student and the patient, directly observing whatever patient care task is being performed. This should include all procedures, including any point of care testing. The other level of supervision is when you're immediately available. So you might send a student to go do an H&P for a patient, but if the student needs help, if a patient is clearly sick and needs medical attention right away, they could come get you and you could be at the bedside within a minute or 2. And when you're working with a new student, before you send them to go perform any patient care tasks, just ask, have you done this before? Do you feel comfortable doing X or Y? And let that guide what level of independence you give the student. The last point here is that anyone supervising our students in a clinical setting should have an affiliate appointment with CUNY School of Medicine. If you're working with students and you don't have an appointment, feel free to contact me and I'll help you with the next steps. It's lcochran@med.cuny.edu. Moving on to mistreatment, it's extremely important to us that our students feel physically and psychologically safe in their clinical learning environment. And all medical students are polled by the Association of American Medical Colleges about mistreatment prior to graduation. And these are some examples. By far the most common form of mistreatment, both nationally and for our school, is public embarrassment or humiliation, reported by about 15% of students as happening occasionally or frequently. We can help minimize this risk by providing our constructive feedback to students one-on-one. And I would also suggest that if you're asking students questions and they're unable to answer a few in a row, especially if you're in a group setting like on rounds, I wouldn't continue to push that or certainly not criticize the student. You should know that. And this slide shows the most common ways that students can report mistreatment. There's an online form that goes to student affairs that students can use either anonymously or not. Students can report mistreatment to their clerkship director or anonymously on the end of clerkship evaluation form. All reports are investigated thoroughly and in a manner that protects students from possible retaliation. For example, our school might wait until after a student had finished their clerkship and received their grade before investigating a report of mistreatment. Lastly, a word about occupational exposures. If an exposure occurs, the attending should be notified immediately and the patient should be asked to wait. A needle stick site should be cleaned with soap and water. Splashes to mucous membranes should be flushed with water. And then the next step depends on whether or not your clinical site has post-exposure prophylaxis protocol and medications available. If yes, the student should follow your site procedure. If no, the student should be directed to take a cab to the St. Barnabas Hospital Adult Emergency Department. And if any questions arise, you can call the SBH operator 718-960-9000 and ask to speak with the ID physician on call. Thanks very much for your attention.